immediate. Within a month, we started seeing tremendous benefit, which was unexpected.
Did you find that one of the things we hear often is that people should be concerned if they're on Coumadin or Plavix about the fact that ProArgi-9 Plus has a small amount of vitamin K? How do you respond to that?
Vitamin K is never an issue when you're anticoagulating patients. As long as they're taking a product on a consistent basis, then we can adjust the medication easily. And I always hear patients who are on Coumadin not to take any salad and green vegetables. And as a cardiologist, that is just opposite to what we are taught. We are told we need to eat vegetables and broccoli because that's good for you. So what we tell our patients, we don't tell them to avoid the product. We said moderation. You don't go eat a head of lettuce. But as long as you're introducing, green vegetables on a daily amount, then we will adjust the Coumadin accordingly. Same thing with any product that contains vitamin K. As long as we know the amount of vitamin K you're receiving is constant, then adjusting Coumadin is going to be easy. It's not going to be a big issue.
So you didn't have any concern at all putting these chronically ill cardiovascular patients from your clinic on 4 scoops of ProArgi-9 with the resulting vitamin K as one of the ingredients, even though many of them or all of them were on Coumadin or Plavix?
But not all of them. A small percentage of them are on Coumadin, on Plavix. No, we did not have any issues with that.
And from a preventative standpoint, when you talk about the stents and the bypasses, even though that's been a very enormous part of your business, do you see any conflict or problem with having that being reduced if people can be improved with having their arteries be perhaps clearing with the use of a product like this?
No, that's what I'm in the business of cardiology, not to do stents. I'd rather not be in the cath lab at all. I'd rather spend my time in the office and taking care of patients. For me, taking a patient to the cath lab and doing a stent or sending a patient for bypass surgery is actually, if a patient has been with me for 5 years, it's a defeat. I'd rather not see the patient in the hospital or in the cath lab or being sent to the OR, which means then I've done my job.
It's music to our ears to hear that, Dr. Siva. We're so delighted that you took an enormous investment. Would you mind me asking, Synergy Worldwide did not come and induce you in any way financially to do this kind of a study. Didn't you take the initiative and essentially fund the study outside of the product for this?
Yeah, the only thing Synergy provided for the study was the product itself. Everything else we did it on our own. In terms of all the testing we did, what we wanted to do with the patients in terms of 6-minute walk test, the laboratory testing that we did, all the stress tests and the echocardiograms that we did, all that was done on our behalf, not on Synergy's behalf. Nobody compensated for it.
And that would have been hundreds of thousands of dollars worth of testing that you invested as a clinic to try to find answers that would help your future patients and your current patients.
That is correct.
Well, we admire that greatly, and we can't tell you how much we appreciate your foresight, your vision, and your commitment to wellness. Do you feel like this type of a breakthrough in this research and the testing that you've done, what can it do for the health care situation in our country?
It will greatly improve in the sense that we should not stop here. As an institute, we should not stop at just doing what we did. We need to take it to the next level. And we are planning the next series of studies that we want to do to see what we can do to our patients, for our patients, not just stop where we are. It's a first step, but a lot more we can do to actually promote this kind of nutritional supplements that will benefit our patients in the long run. We do not want to bring the patient in another 3 years and do another stent, or bring a patient in for another 6 months and do another stent. Remember, stenting does not prevent heart attacks. It only improves symptoms. My job is to prevent a heart attack. We want to prevent another procedure. So we will do what we need to do to fix the artery at that time, then be aggressive in risk reduction, and that's where ProArgi-9.
What about pulmonary hypertension? Did you see any improvement in the study on that?
We have a large population of pulmonary hypertension patients, and that is one of those benefits of using ProArgi-9.
That's exciting because it sounds like a lot of people went from using oxygen almost 24/7 to not needing that. Is that something that surprised you?
If it is truly pulmonary hypertension and we were to measure the pulmonary pressures pre and post treatment, and they had significant improvement, then it was not surprising to see them no longer requiring oxygen.
Lastly, sometimes that people ask me, what impact does the dilation and the clearing of the capillaries and arteries have to do with renal failure or even other organ disease outside of the heart or cardiovascular disease? What kind of an observation do you think you can judge from your experience now over the last 6 months?
Think about it. Everything depends on blood flow. Blood flow governs whether you have a stroke or you don't have a stroke, whether you have normal liver function or not, whether you have normal kidney function or not. So as long as we improve blood flow, then all these organ systems will be healthier. So as we grow older, as the arteries become harder, they become less compliant. These are the reasons why kidney functions fail. If you look at a person who's 70 years old, their kidney function is half what it was when they were 30 years old. Why? It's because of cellular death contributed to a certain extent by lack of or inadequate blood flow. So if you're improving blood flow, then you're improving survival of this tissue.
Did you find that neuropathy was one of the first things that seemed to be an improvement among the people that were in the study?
Not so much as neuropathy in terms of symptoms of pain, but in terms of improving their circulation. Remember, part of the reason why the legs develop neuropathy or neuropathic symptoms is because of lack of circulation. Peripheral vascular disease is one of those things that is very prevalent in our population, especially in our diabetic population, and goes along with it comes neuropathy because of lack of circulation, which is contributing. It's not all of it, but it contributes. So if you're improving microvascular circulation, then you're going to improve symptoms of neuropathy.
You've heard from Dr. Siva Arusalam, and we're so grateful for his investment of time and energy and resources, and that of his staff, in trying to assess the value of ProArgi-9 Plus for the many patients that he has been trying to treat. And on behalf of a grateful group, the Como Cardio Institute, which is pursuing, educating people throughout the world on the benefits of this great product, we're so thankful to you and the many lives that we know are going to be saved because of your investment in research. Thank you very much.